Great. Thanks very much, Chandra. Welcome, everybody, to our weekly media information session. For those that are new to the session, my name is Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit. And we host these weekly sessions for information and updates related to COVID-19. I follow the same format every session, which is to start with an introduction or update on the numbers or the epidemiology of COVID-19, followed by some updates related to vaccination, and then some general comments related to public health measures related to COVID-19. I will today also touch on a couple of additional things. So one related to testing, as well as additional measures that have been introduced by the province related to protecting long-term care homes against emerging variants of concern. So getting started, I'll describe a bit of what we have been seeing locally for COVID-19. Since the start of the pandemic, we've had a total of 2,686 cases of COVID-19 in HKPR jurisdiction. We currently have 59 active cases, 2 in Haliburton, 36 in the city of Kawartha Lakes, and 21 in Northumberland. We have 130 high-risk contacts that we are continuing to follow up with. We currently have 5 outbreaks that are ongoing related to COVID-19. Of note, the outbreak that was at Campbellford Memorial Hospital has been declared over. Currently on the list of active outbreaks, there are 3 outbreaks at schools, 1 outbreak at a childcare center, and 1 outbreak associated with a hockey team. Our weekly incidence rate has continued to increase. So today we are sitting at around 36.2 cases per 100,000 population. To put this in perspective, just 3 weeks ago, really, we were sitting at around 5 cases per 100,000. On the other extreme, we can look to neighboring jurisdictions such as Kingston, which has seen an exponential growth in COVID-19 cases and is sitting close to 350 cases per 100,000 population. The increase in cases that we have had locally has been driven by the Delta variant to date. We did today just have our first lab specimen that screened positive for a mutation that is indicative of the Omicron variant. And I'll speak a little bit more about that in a couple of minutes. Our test positivity has also continued to increase and is hovering around 2.5%, sometimes a bit higher, sometimes a little bit lower. I think in summary, if I had to describe really what we're seeing in terms of cases locally, we are seeing a steady increase now associated with both a higher number of outbreaks, but also a higher number of cases in total, including broader community transmission of COVID-19. If we look specifically at the last 14 days and characteristics of cases identified in the last 14 days, we've had 115 cases. 23% of cases have been in the age group of 0 to 9, so under 10 years old. 16% of cases have been among the age group of 40 to 49. So we have continued to see a higher proportion of cases among younger age groups, and that I think is also reflected in our outbreaks that are associated with hockey team in that age group and elementary school outbreaks. 30% of the cases in the last 14 days have been household contacts of confirmed cases, 18% close contacts, and 18% with no known source of transmission. I'll spend just a minute speaking specifically about school-age cases, as we have seen more cases in this group. We've to date in this school year had 62 cases associated with the school-age population, whether it be students or staff. The majority of these cases really have been acquired in the community and not through school settings. The school-based outbreaks that we have had, so we currently have 3, although the numbers have increased slightly, they're still ranging between 2 to 4 people involved with each outbreak, but they're also interconnected with community activities. So sometimes it's difficult to determine whether or not the exposure was actually at school because the kids are in the same class, or if they're in another activity outside of school that they're also doing together. We are seeing significant overlap with some of these extracurricular activities and school-based activities, which has made it a bit difficult to tease out actual exposure locations. At this point in time, we have 22 school classes that have been dismissed and are isolating at home, 4 bus cohorts that have been dismissed that are isolating at home, and 3 sports teams that have been dismissed, so not actively participating in their team activities. Across multiple health unit jurisdictions over the last couple of weeks, we have had a number of outbreaks identified among hockey teams, mostly associated with hockey tournaments. And so there does not seem to be transmission, I think, as much on the ice as much as there is in interactions in the hotels or other settings where teams might interact with other teams, or you have parents, guardians of players that are interacting with each other. But we have seen multiple tournaments associated with increased COVID case numbers. And so I think as we look at the next couple of weeks and we look at the introduction of the Omicron variant, we are highly encouraging everyone to be quite cautious in their interactions and reevaluating current restrictions related to activities. As I mentioned before, we did just today have our first laboratory report that was indicative of the Omicron variant of concern. It has not been confirmed by whole genome sequencing, but it has screened positive for a mutation that could indicate the Omicron variant. If you recall a couple of months ago, when we were looking at other variants, such as the Alpha variant, the laboratory would do an initial screen for mutations, and that would give us an early sense of whether or not it was the variant. We kind of stopped talking about that initial screening because the Delta variant didn't have a screen positive to determine if it was the Delta variant. With the Omicron variant, there is a screen, it's called the S gene target failure or S gene dropout screen. It does not 100% mean that it's Omicron. It could be other variants, but it's used as an early indicator and is most likely Omicron because we're not seeing other variants such as the Alpha variant. It still takes 1 to 2 weeks to get the results of whole genome sequencing back. So it does take a bit of time to confirm 100% if it is an Omicron variant. I've mentioned previously, and I think folks have likely seen it from other media sources, that the Omicron variant has certainly gotten a good foothold, I think, in other locations in Ontario. It's not a surprise that we have a case in HKPR jurisdiction, and I know that Peterborough, our neighbors, have also identified some initial cases. We should expect over the next couple of weeks for more and more cases that are identified to be the Omicron variant rather than the Delta variant, as the Omicron variant starts to become the dominant strain. And this seems to be the cycle that we're in, where you have a new variant that essentially outcompetes the previous variant. So we saw that happen with Delta, which outcompeted Alpha. We now have Omicron that is working on outcompeting Delta. And I think that until we see globally, a general reduction in COVID activity, will continue to see mutations, with some of those mutations really being insignificant, and some mutations that have given essentially an edge to this new variant, and so it slowly becomes the dominant one. Moving on to some updates related to COVID-19 vaccination. Our coverage in terms of 2 doses is currently at 85% of individuals aged 12 and over, and 87.3% having received 1 dose of vaccine. Among 5 to 11-year-olds, our coverage as of Monday this week was at 24.3% of 5 to 11-year-olds having received their first dose of COVID-19 vaccine. When COVID-19 eligibility first opened up for 5 to 11-year-olds, we did see a very good uptake. Appointments filled quickly and clinics were full. After about the first 2 weeks, that has calmed significantly, and we see much slower uptake among this age group, or among the parents or guardians that are signing them up to be vaccinated. This isn't surprising. We know that parents and guardians are extra cautious in terms of children. This is the pattern kind of historically when other new vaccines are introduced for this age group. We do know that there continues to be close attention paid to the safety of the vaccine and effectiveness in this age group, and it continues to demonstrate a good safety profile, and it's certainly, as indicated by the general numbers we see, important to continue to offer vaccines for this age group. In terms of other age groups, you'll know that the province expanded eligibility for booster doses for anyone aged 50 and over if it has been 6 months or 168 days since their second dose until they get their booster doses. We also know that because of the Omicron variant, there has been heightened awareness and urgency associated with getting a booster dose. The initial evidence or data around the Omicron variant has indicated that 2 doses of vaccine is not as protective against the Omicron variant as it was against the Delta variant. There is data coming out of South Africa as well as the UK around the added benefit and protection of a booster dose from COVID-19 vaccine against the Omicron variant. It is not 100%, but it is a boost or an improved protection compared to 2 doses. Taking that into consideration, the province has certainly put increased pressure and urgency around booster doses. And as such, we have seen, similar across the province, very significant demand for booster doses. We know that just this week, greater than 40,000 people across HKPR jurisdiction became eligible to get their booster dose. Given this sense of urgency, we have internally at the health unit redeployed many of our staff to further support immunization efforts. Again, we do have competing pressures associated with actual case and contact management and outbreak management and other critical services that we do need to continue, such as non-COVID related outbreaks or infectious diseases. But we have otherwise redeployed any staff available to support this effort. We're continuing to work with health sector partners across the board, including primary care, paramedics, to see what else can be done to support clinics and improve availability to vaccination. In response to really the emphasis on booster doses that came out on Monday of this week, we have added an additional 4,000 appointments to existing appointments in the system just for next week, and those appointments are being uploaded today. They might be up there already, I'm not sure, as well as an additional 4,000 appointments for the following week. We've been looking at expanding capacity through two main ways. One is by expanding at existing clinics, the number of people we can see go through that clinic, as well as adding additional clinics. There's a couple of things that do limit our ability to expand even further than that. So one is that when we were at the height of our kind of vaccine clinics several months ago, we did have increased support and capacity from hospital partners. You might recall that some hospital partners were running clinics that were able to offer 1,000 appointments a day. Those hospital partners are now under significant pressure related to services at their facilities, so they're underserved. They do not have the ability right now to support vaccination the same way that they did several months ago. Primary care is being asked to further support immunization, and you will see some primary care clinics, again, to the best of their ability, based on current demands, be offering vaccination either through their clinics or in supporting the health unit-led clinics. I'd encourage anyone that is still anxious to get a booster dose and that does not have an appointment, if you would like an appointment at a health unit-led clinic, to recheck PBS, as we are uploading additional clinics. And then there are other opportunities. So ensure that you have checked the pharmacies in your region. We do know that they are continuing to receive vaccines. We know that some pharmacies have been administering up to 200 doses a day and seeing a huge number of people come through. The province is working to quickly resupply vaccine to pharmacies or to health units. Overall, supply in the province is not a concern. What is more of the rate limiting factor is the actual resources in terms of humans who deliver vaccinations or put jabs in arm, and then the venues that are available to be able to see the most efficient clinics as we can, see the highest number of people come through in a day. The venues that we were using previously, like hockey rinks, are now being used for other ice-related activities. And so we just don't see the same venues to have the same volume of people come through. That being said, we're doing everything we possibly can to maximize opportunities both this week and next week and the following week to try and meet this expanded demand for booster doses. A couple of notes related to health unit-led vaccination clinics. Starting tomorrow, we will not be accepting walk-ins for booster doses. I also saw the media reports of long lineups at some of our clinics this week. And given the demand, we have decided to stop walk-ins for booster doses, but we have added appointment clinics to our clinics for the next couple of days. And then in addition to the number of appointments added to the system for next week. The other update I have related to our vaccination clinics is that moving forward, we will be asking clients that come to health unit-led clinics to be putting on a surgical mask or a medical grade mask. That people will be asked to either exchange their cloth mask for a medical mask or to just put the medical mask over top of their cloth mask. And this is consistent really with many other facilities or locations offering or providing health care. And we want to ensure that, especially given the Omicron variant, we are doing everything to the best of our ability to ensure health and safety of the clients we're serving, as well as the staff at the health unit. I'm going to move now to a couple of quick updates related to testing. I spoke a little bit earlier about just the screening test that's being done on samples that are submitted through the provincial laboratory system. I think the other hot topic related to testing is rapid antigen testing. And I know I'm certainly receiving a lot of email questions about it and seeing lots of discussion on social media and other media sources. So a reminder that rapid antigen testing is used for people that do not have symptoms, are not identified as a high-risk contact, and really they're used as a form of surveillance testing. There are some other jurisdictions that have really made rapid antigen tests widely available to the public, and we have not had that same strategy in Ontario. At this point in time, at least throughout HKPR jurisdiction, there's a couple of key focuses for rapid antigen testing. One is through the school system. I'm sure people are familiar that the Ministry of Education has distributed rapid antigen tests to every school for them to be sent home with every elementary or every student for over the winter holidays. The intent is for students to do a rapid antigen test every couple of days. Each student is sent home with 5 tests. This is partly to monitor now that they're home, to ensure that there's nothing kind of left over from the school year, and also really to ensure a safe return to school in January, given that there might be other exposures during the winter holidays. I am highly encouraging students and families to participate in that rapid antigen testing program. I think that it is a key tool, one of our many tools that we can use to identify COVID-19 early. A couple of strong reminders. So one is that if you test positive on a rapid antigen test, you need to have a PCR test done at an assessment center to confirm the results. And the other is that if you do have symptoms, that you should be going to an assessment center for a PCR test and not to rely on the rapid antigen test. The other more recent news related to rapid antigen testing is the expansion again of rapid antigen tests at long-term care homes. So with the emergence of the Omicron variant and recognizing that 2 doses of vaccine is less effective at preventing infection as well as symptomatic illness, the Ministry of Long-Term Care has implemented additional precautions, including the use of rapid antigen tests for staff and caregivers, regardless of whether or not they have been vaccinated. And this is an extra precaution. In addition, I know the ministry is re-looking at the use of rapid antigen tests in light of Omicron through other health sector partners, and they've continued to encourage their use through businesses through the Ontario Rapid Antigen Screening Program. I've had a couple of inquiries as to whether or not the health unit will be distributing rapid antigen tests or providing any pop-up locations. So we do not have any rapid antigen tests actually at the health unit. They have not been distributed through the health unit. Any of the rapid antigen tests that have gone to schools come directly from the Ministry of Education to the school, similar for long-term care homes, hospitals, in those other settings. There was or is a pilot that the Ministry of Health has done in some jurisdictions where they are offering pop-up rapid antigen test locations in public settings. So, for example, there are some mall locations, not in HKPR jurisdiction. I believe there's one in Peterborough, and I'm not sure about Durham, where the ministry intends to hold a pop-up site to distribute rapid antigen tests. My understanding at this point in time is that that initiative isn't continuing, but I don't have further details about it. And I know that none of the locations kind of selected as a pilot have been in HKPR jurisdiction. Otherwise, I know that our partners at our assessment centers are continuing to work diligently to ensure access to testing, PCR testing, and know that over the next couple of weeks, it's likely to be a challenge for them with likely increased demand for testing, holiday season, and some of the other non-COVID related illnesses that we sometimes see a surge of over the winter holidays. Finally, a couple of other comments just related to broader public health measures and enforcement of public health measures. So the health unit has continued with our partners to enforce the regulations under the Reopening Ontario Act related to COVID-19. I've spoken before that we take a progressive enforcement approach that starts with engagement, involves education, and then really as a last resort, we activate some of our other enforcement tools. And we will continue to do that, certainly as there is a heightened risk of the spread of Omicron. Further to that, I've certainly had some questions about, will I be issuing a letter of instruction under the Reopening Ontario Act that adds additional measures in place for HKPR jurisdiction? I was asked about this, or whether I was considering it at last week's media session, and I think also at the week before, and it is still actively under consideration. I strongly support a pan-provincial approach, and we did hear the Chief Medical Officer of Health yesterday say that with the changing dynamics of the Omicron variant, a regional approach will not have the same success at stemming the spread of Omicron, or at least slowing it down, as a pan-provincial approach will. It's my understanding that we should be learning in the next day or so of potential further provincial measures. However, if we do not see additional provincial measures, then we will be issuing local letters of instruction, given the recent surge in cases that we're seeing here, and then the enhanced risk associated with the Omicron variant. Finally, looking at my multiple pages of notes today, as you're probably thinking, when will she stop talking? Don't worry, I'm on the 4th page, but it's a short page of further updates. So I think I wanted to close off with some holiday strongly encouraging wording. So I am strongly encouraging all residents across HKPR, businesses, organizations, partners, that at this point in time to be canceling any of your large holiday parties. We should not be having large holiday parties right now. If you are planning on gathering, these need to be small gatherings, either just within your household or perhaps one other household. If you're meeting individuals outside of your household at an indoor location, do your best to improve the ventilation, perhaps by opening a window every now and then and circulating some other air. If there are individuals with immune compromising conditions, like medical conditions that affect their immune response, consider wearing masks inside. If you're going out to public places, again, all of the same COVID restrictions are there in terms of wearing a mask at indoor public locations. I encourage you to make sure that it's a tight-fitting mask. The masks that we see that are situated below people's noses are not very effective. We want people to be wearing masks properly and to be tight again, so that you're not having a leakage of air around the sides. And also strongly encouraging, I think, those workplaces that are able to be encouraging people to work from home where they can. And I do think that as much as we all want to see our closely held holiday gatherings and cheer the way they were before, this holiday season with the emergence of Omicron is not the time to be doing that. So I know this is frustrating for everyone, I think myself included, frustrating that we find ourselves in this position again this year. But I think we are all doing what we possibly can to minimize the fast spread of Omicron, and to look at what we can do to be able to celebrate festivities in other ways. We know that we can be creative. We've done it before, and we can do it again. And I think with that, with people's frustration, encouraging people to treat each other with kindness and patience as much as we can, as we know that people will be just in general frustrated that we find ourselves in this position again. But we also know that we'll get through to the other side, so some light at the end of the tunnel. All right, so that's the end of my multiple pages of notes. Thank you for bearing with my longer update today. But so I'll stop and happy to take any questions.
Okay, thanks, Dr. Bocking. lots of information for sure, and I've got a couple hands up. So if I'm missing a hand, let me know. So first I have Dan, then I have Sam, and then I have Lee, and then I've got Derek. So Dan, do you want to get us started here?
Yeah, thanks so much, Andrea, and Dr. Bocking, as always. First off, you mentioned that if the province doesn't implement further measures, that you will consider your own. I guess, how strong or what can people expect if the province doesn't implement some measures in the next few days?
So we're closely monitoring both our COVID activity and activity of our neighboring jurisdictions. We do know other health unit jurisdictions that, in response to similar activity, have implemented measures related to capacity limit restrictions. So decreasing capacity limits at either the businesses, organizations, enhancing physical distancing requirements, enhancing masking requirements. It would be, I think, familiar measures that we've seen in our earlier steps of the regulations within the Reopening Ontario Act.
Okay, perfect. Yeah, and some on booster doses, I guess. With the way it's going, do you foresee in the future the need for possibly an annual booster? I guess.
I don't know that I fully understand the last part of your question, Dan. Are you asking if we might see additional boosters of boosters?
If in future years that some boosters will be required or necessary every year, I guess.
Mm-hmm. Yeah, I mean, I think it's too early to know for sure. I think that it is likely, and we've seen that with other vaccines and other viruses. So I wouldn't be surprised, but I think it's too early to know for sure.
Okay, thanks.
Great, thanks, Dan. Next, I have Sam up. Sam, do you want to go ahead?
I'm Dr. Bocking. So in Haliburton, we have a lot of seasonal residents who might be planning trips to their cottage for Christmas. What would be your advice for people that live outside the region that are kind of planning an interregional trip with the rising case counts this time of year?
Mm-hmm. So I think it's similar to what message has been in previous waves of the pandemic. So if you're traveling to a seasonal residence that you're going to that residence, that you're not hosting large parties at that residence, that you're following all of the local COVID precautions, and that you're continuing to participate in all of the measures that we know well now that will help to protect against COVID-19, which includes vaccination.
Sam, do you have a second question?
That's all for me. Thank you.
Okay, thanks, Sam. Okay, next I have Lee with his hand up. Lee, do you want to go ahead?
Yes, thank you very much. So with the new restrictions on long-term care and retirement homes being released yesterday by the MOH for Ontario, it appears like it might be another lonely Christmas for long-term care residents, which, that does a lot of harm in terms of their mental health and depression and that kind of thing. So do you support what was handed down yesterday? You know, it kind of boggles the mind a bit that a resident who wants to go home to see their family, maybe overnight, maybe they live out of town where the long-term care home is, they're going to be discharged from the home and then readmitted again. It just seems to me like it's very heavy-handed. What are your thoughts on that?
Mm-hmm. I think, as you point out, this is a really delicate balancing act. We know that there are harms associated with the public health measures that we're using to try and prevent infection. And that includes mental health, emotional health. I mean, we know that there's ramifications in all areas of health. I think that we are so far along in the pandemic. In some ways, we're forgetting the very significant toll that COVID-19 had on long-term care homes in the very first wave, with very high mortality rates associated with that, and some homes being impacted particularly hard. We, I think, have had some comfort in knowing the protective effect of vaccinations against long-term care among residents of long-term care homes, and that has provided a sense of caution or of comfort as we've opened up some activities. I think right now with Omicron, there's a very significant concern that we don't want to see I think really significant impact on long-term care homes that we did in the first wave of the pandemic. So it's absolutely a very delicate balancing act. And I think, you know, if nothing happens, people will say that we didn't need it in the first place. And then if something happens, we'll say that it wasn't strong enough. So this is part of the ongoing road of this pandemic.
Yeah, that makes sense. I understand totally. But looking ahead, you're not a politician. I get that. You're doing your job. But our politicians keep saying, you know, we're going to beat this thing. We're going to beat it. But people don't believe that anymore. I really believe that people think this is here to stay. What's the next variant that comes? What's the one that comes after that? So what advice do you have for people out there, you know, who are going to listen to the radio and watch us on TV, read the newspaper, that let's say this is never going to end? What do you have to say to them?
Mm-hmm. Well, I think that our goal is to figure out how we live as a community and society with COVID-19. We know that there are going to be ups and downs. I think COVID-19 is not going away, certainly anytime soon within this decade. It will continue to mutate. There might be additional variants. But so I think it's how we figure out a balance of living with it, what level of risk we're comfortable to live with associated with it, and then perhaps in very high peak seasons we have some measures, and then in between we don't. I think we're quite hopeful also that vaccination will continue to decrease the level of risk for communities associated with outbreaks of COVID-19. Relatively, we're still early in the pandemic compared to historical pandemics. So it doesn't feel like it's been a short period of time, but it is relative to other pandemics we've seen historically. So I would certainly tell people not to give up hope. We're entering another storm right now. We need to weather this storm for the next couple of weeks, potentially couple of months. But we will come out to the other side and continue to figure out how we can find a balanced way of living with this virus.
Thank you, Dr. Bocking.
Great. Thanks, Lee. Thanks, Dr. Bocking. Next, I have Derek. Derek, do you want to go ahead?
Yes, good afternoon. Thank you for taking the time to answer this question. Recently we've seen a lot of people getting vaccinated. We have higher rates than ever, but yet we still have this really astronomical uptick in COVID numbers. What do you attribute that to?
So there's a couple of things. So So I think we're seeing an uptick in COVID numbers for a number of different reasons. So one is colder weather, people are moving inside, people are gathering more with each other. We had a number of kind of holiday weekends over the fall. We knew that by this point in time in the fall, we would be seeing increased COVID activity, just even based on those factors. We know that COVID as a virus is infectious enough that with even high vaccination coverage rates, we'll still have some virus circulating. I think where people are getting a bit stuck is we're comparing absolute numbers of people that get COVID if they're vaccinated or unvaccinated. And I think the key here is, at least with the Delta variant, when we're talking about this, that we're not comparing the absolute numbers, we're comparing the risks of developing COVID if you're vaccinated or unvaccinated. Because if our pool of people that is unvaccinated, let's say we have 10 cases of COVID in a pool of 1,000 people, and then we have 10 cases of COVID in a pool of 20,000 people that are vaccinated. So we're not comparing quite apples to apples. We need to look at the actual risk among those groups. And we know that your risk of developing COVID-19, developing symptomatic illness, or getting severe disease is much, much lower with vaccination. Unfortunately, with Omicron, 2 doses is not as effective. And so we are seeing the need for a booster dose to really bump up that level of protection and mitigate the impacts of Omicron.
Okay, and just my follow-up question, it actually goes along with a question you just answered earlier. We're going to be looking at this over, the pandemic, maybe over 10 years, as you were saying. At what point is this an endemic?
Yeah, lots of discussion about that, and lots of epidemiologists commenting and infectious disease specialists. And I think that, so the short answer is I don't know. I think we had thought we were getting closer. So the more people in a population that you have that have immunity, either by vaccination or naturally acquired some immunity through infection, the less you see a high steady level of infection. So when we reach a period of time where COVID's here and we see these pop-up outbreaks now and then, I think that's the state we're working towards. But the new variants are really throwing us for a bit of a loop with that in terms of needing to ensure that vaccines are equally as protective against these variants. So I know I didn't fully answer your question, Derek. It's a tricky one, and I think we'll continue to learn more.
Thank you. I know you face a lot of questions that almost seem unfair, so I appreciate you're a good sport about it. Thank you.
my attempt. Yeah, you're welcome.
Great. Okay, thanks, Derek. Next, I have Catherine Whitnell. Catherine, do you want to go ahead?
Certainly. We've received, Kawartha Lakes this week has received a couple of recent emails from people who have gone to the mass immunization clinics, booked appointments, went at their time to get their booster shot, and have been told that because they have 2 different doses, an AstraZeneca and a Moderna, or an AstraZeneca and a Pfizer, that they cannot receive their booster dose and they have been sent on their way. Is this a misunderstanding? They were notified this at the, I don't mean to throw anybody under the bus, but at the Lindsay clinic, and by the individual who is overseeing individuals that were showing up for their appointments. So is this a miscommunication thing? Is this a misunderstanding? Or is this person correct that unless you have, like what some cruise lines were requesting, the same, 2 mRNAs, that you can't get your booster shot?
So a couple of comments, Catherine. So firstly, anyone age 50 and over that has 2 doses of vaccine, it doesn't matter if it's mRNA or mRNA and AstraZeneca, is eligible for a booster dose. I'm familiar with the situation you're describing because it did come to my attention. So I believe it occurred, I think, Monday morning, and those individuals were sent away in error. Our team did collect the names and numbers of anyone prior to sending them away, and we're calling people back to clinic. I think the miscommunication or misunderstanding was flagged by late morning of Monday, and it was corrected. So it should be really anyone that is age 50 and over. If they received a dose of AstraZeneca and a dose of Pfizer, they are eligible for a booster dose as long as it has been 168 days.
And I have a second question, if I can ask it.
Yep, go ahead.
A colleague of mine received a text message that apparently people are selling their rapid antigen tests to make money. Have you heard anything about this? And I mean, how much does a rat test cost? I mean, can you make a lot of money, and you can only have one if you have kids in school?
So I'm smiling a bit because so I haven't heard of this specifically in this scenario, but the entrepreneurial spirit always seems to shine through. So I'm not necessarily surprised by this. So rapid antigen tests are available to purchase at some pharmacies. I know they're available to purchase online, I think via Amazon, I'm not sure. I think we would want to encourage people to ensure that if they're ordering and paying for rapid antigen tests, that they're doing it kind of from a reputable company. But I think we see a variety of things happen in different times. So I do know that test kits are available through pharmacies and other locations. So I think that if people have questions about where to get it, there's lots of information kind of available about where we can get it, not just kind of on the street corner.
Thank you very much, Dr. Hocking.
Yeah.
Great, thanks, Catherine. Okay, so next is actually Sue Tiffin. Sue comes up as press, but it's Sue. So Sue, do you want to go ahead?
Sure. Hi, Dr. Bocking. My question is about airborne transmission. Can you probably spoke about this earlier this year, but can you speak to that a little bit and what people might need to know about it? Because I don't know that everybody fully understands how that works.
Right. So when COVID-19 first emerged, there was certainly lots of discussion about how it's transmitted, and we know that there's for viruses a spectrum of how they can be transmitted. Sometimes they're transmitted by large droplets. So if somebody coughs or sneezes, sometimes by smaller droplets, and sometimes by even smaller droplets or aerosols, which we sometimes call airborne transmission. We can think of some other viruses that are very, very infectious that are transmitted by aerosols or airborne transmission, such as measles. I think when COVID-19 first started, it was thought that it was primarily large droplet transmission. But over time, I think evidence has emerged that smaller aerosols can transmit the virus also. And we saw both Public Health Agency of Canada coming out with not a statement, but updating their material, as well as the CDC in the US, including aerosols as a way that it's transmitted. What this means to me is that we do need to be careful about our mask wearing, and that in settings where there are higher risks, so small indoor space with high risk activities such as singing, that it's possible for not droplets, right, but the aerosols to carry a little bit farther than, say, a large droplet that will then kind of fall to the floor. So we want people to be cautious and aware of kind of ventilation. If they're in an indoor space, that they are, that you're wearing a mask properly, that it's tight fitting. Because I think that, you know, as we continue to learn about this, we do want to be cautious. Sorry, I was going to add on an extra bit about Omicron. Just that, I mean, Omicron has not been identified to transmit a different way, but it has been identified to be more infectious than the Delta variant.
Okay, and does it sort of travel like secondhand smoke in a sense for people to have a visualization? I saw that the health agency in the UK was suggesting that.
Yeah, so it's tricky because there are so many things that interact how a virus is going to travel out. So I don't think it's as simple as every time somebody with COVID-19 breathes out, it spreads evenly throughout the air, because it depends how much they breathe out. It depends on humidity of the air, kind of air currents, or kind of how the flow of the air is, or the ventilation. So I don't know if that's the best analogy, but certainly there is the possibility in some circumstances that you might see aerosols go beyond that 1 meter or 2 meters.
Okay, thanks. And can you also just speak to the local letters of instruction that you mentioned? Can you tell us more details about what that might look like?
So I don't actually have them all confirmed at this point in time. I can say that we've looked to other jurisdictions, including Algoma, Sudbury, Southwestern Public Health, at the different restrictions that they have implemented in response to rising cases. I think generally when we think about restrictions, letters of instruction tend to involve directions for businesses, organizations related to things such as capacity limits or work from home. If we're looking at limits to gatherings, such as like in households, that sort of thing, that tends to be more of meeting other Section 22 letters. And that's what we've seen Kingston do in light of the Omicron variant, where they've issued a Section 22 order with a maximum of 5 people per gathering. I am just seeing Chandra's note. Am I free? There's actually a call with the Chief Medical Officer of Health Office at 3. Typically, I would say yes, I don't have a problem, but I will have to leave at 3 today. I'll stop being as lengthy in my answers.
Okay. So I think, Sue, you had your 2 questions then. And
That's
I'm
right.
just
Thank
kind
you
of
so
looking
much, Dr.
through.
Bocking.
Thanks, Sue. I see a lot of hands. I'm assuming they're old hands, but I haven't. So Mark and Jessica are the 2 left. Can you ask something quickly, Mark?
Chandra, I could just send you an email. I'm just looking for the percentage of residents that are eligible for the booster dose. I know that Dr. Bocking said it in her thing, and I don't want her to have to go through her pages of notes to answer my question. So I'll just send you an email, because I did try to get it, but I missed it. So
no, that's fine. That's fine. Not a worry. And Jessica, what about you? Are you? Do you have a quick question?
Yes, I do. I have more than one, though. Sorry.
Okay.
So you just mentioned, Dr. Bocking, no additional walk-ins. I just wanted to clarify, for 3rd doses or at all?
So my understanding right now is that if somebody were to walk in with an appointment for a 1st dose, that we would still be trying to accommodate, really trying to get 1st doses in, that this applies to 3rd doses. I'm looking to Chandra to see if I need to be corrected there, although Chandra's frozen.
No, am I frozen?
Okay.
Am I frozen? We're trying to get all 1st, 2nd, and 3rd doses to book appointments. But if somebody does happen to come in as a walk-in for their 1st dose, they will be accepted, but not for 2nd or 3rd.
Okay, and then just one more quick question. Dr. Bocking, I believe you said a regional approach isn't enough. Did you say that, stricter measures need to be taken, regional approach isn't enough? That means that it's up to the province to do something. We've kind of all been waiting for that. How is it for you? What is it like for you to have to make these decisions? You're saying regional is not enough. So that means you're looking to the province. Are you feeling frustrated?
I think that all medical officers of health right now are seeing kind of the risk of certainly the Omicron variant, the impact of the surge of the Delta variant, and understanding that that we need broader public health measures. And as a collective, a Council of Medical Officers of Health, we have communicated this, and I think we'll continue to put forward recommendations. Ultimately, as a regional or a local medical officer of health, we're responsible for the residents in our jurisdiction, and so we'll make decisions based on that. And as needed, certainly we'll issue letters of instruction or section orders under our ability. But we know that the virus does cross our jurisdiction borders, and so when I see a neighbor experiencing significant pressures, I know that certainly we have that potential also for increased activity in our region.
Thanks, Dr. Bocking. Keep up the good work. Keep fighting the fight.
We'll still be here. We'll be here next week too. Hopefully,
yes. Yes. So thank you to everybody for participating. As Dr. Bocking said, she has another meeting right now, so unfortunately we will have to cut things off. So thank you to everyone for your help in getting this information out. I see I've received an email from Mark, so if there are any follow-up questions, please feel free to send an email to myself or Bill, and we can certainly provide some information. So I want to thank everybody for joining us today. And as Dr. Bocking indicated, we will see you next week on the 22nd of December for our final media information session of 2021. Okay.
I'll keep my notes shorter next week. Thanks very much, everybody.
We appreciate it. Thank you.
Okay. Thanks, everybody. Bye.